Mohammed Kingston, who is a former president for the Society of Pharmaceutical Surgeons and Neurosurgeons. Together with him, gave me a task of finding how to collaborate with the Rotary Club in Uganda, and I thought of Rotary Club in Nigeria.
Bring out the gaps in terms of hernia treatment, hernia prevention, hernia care, so that once we know the gaps, the project wishes to close those gaps. And once the gaps are closed, then we are able, as Chabirwa, to perform better.
Question 1. What is the current burden of hernia cases seen annually at the hospital?
Is that question in terms of how many hernia cases we complete annually, or in terms of what's the burden managing hernia cases means? So to put it in perspective, we do on average, this year we're aiming at 2,000, but on average 1,800 procedures, cases, surgeries. And 3/4 of those surgeries are generally hernia cases, whichever hernia category, but hernias are the biggest number of surgeries that we cater for here.
And basically what this project looks at is ensuring that health facilities get access to hernia mesh, because for the surgical officers or surgeons in the house, you know that often hernia mesh is not very accessible.
We follow up all our patients in their homes to make sure they are recovering well. We're taking very good care of them, of their health. That's not a cheap program, as you can imagine. We have nurses that ride on bikes and traverse the community everywhere to check on every patient that we operated on. We do this on day 3, we do it on day 7, sometimes if necessary day 14, all the way to day 30. So that's a cost. Community follow-up. That program is called Recovery at Home. It's a cost that we can't ignore.
Abantu bogera kidwaliro kubya hernia.
Okusokerera abantu basaba service n'ebirero n'okwasa abalwadde ba hernia kuba nti service ziri kumpi mu kyalo. Omuntu alinga mu transport okuba okujja mu tawuni aba asemeze kulina transport. Ekyokubiri n'abakozi b'efuwani bahalinga mu gyalo b'ebifa b'ekyalo. Kulanga director wakwetwa baba following omuntu yajja waka yabona kyekisekuta kulaba bulungi yabikula ekirwaire yakininga ekitegeera. So babanda benulinkiza emuki n'endwaliro. Ekyokusatu niiseetu bantu bakyajinga tetagagenda kujawa kujja kuliya.
And what the mesh does, it induces massive inflammation that induces fibrosis and inhibits, gives a very good scar that inhibits recurrence of the hernias. That's how basically it works. But you find that in our country, we've toured around five hospitals. This is the last one. And some facilities, even you find that people have never heard of the mesh or have never seen it.
Is a team, a committee? Is it one person and who checks the other? Like when I issue a voucher, somebody else approves. Another one else does what? She recommends. Can you share something about that, please?
The sterilization department has 2 staff who work there, and they do the testing. B&Bs, like I said, is done every month. When they do the testing, they document, and I do assess all my assistant assessors and signs on that. Then for the chemical integrator, it is a team, it is a process. Every cell that is sterilized, they put a chemical integrator.
We started the project by applying for authorization from National Drug Authority that provide the literature and they gave the authorization report.
Is usually challenging. So So the people you see here, they are dedicated. Getting a surgeon to be in one place, it is usually next to impossible.
And according to the layout of the project, each hospital is entitled to a standard autoclave, that is Ishman, and requires these autoclaves, they require distilled water. So when Professor Andrew was somewhere in a video chat, one of the daughter works with the US Embassy. They only use distilled water, and they are able to make the distilled water within their facilities. So we got in touch with the company, and we will be able to supply facilities with devices that can make the distilled water. Bosnia International has a cluster of close to 30 surgeons who visit the world to do surgeries and do the internship. So depending on the need of the facility, we shall start to collaborate.